Hi, my name is Stephen Harris, and this is my pediatric physical assessment for nurse 317. Okay, I'm going to knock on the door. Hello, may I come in?
Yeah.
Hi, my name is Stephen. I am a student registered nurse at West Coast University. I am going to be doing a little physical assessment on you, okay?
Okay.
All right. So as I am entering the room, I am going to wash my hands for 20 seconds according to CDC guidelines. I am also going to be doing my environmental check, make sure that oxygen is working, suction is working adequately, and there are no environmental hazards or clutters. So I am going to be doing a physical assessment, like I said. And what is I'm going to check your wristband. What's your full name?
Juan Alvarez.
And what's your birthday?
December 16th.
And how old are you?
I'm 17.
So perfect, 2003. All right, so do you have any allergies?
No.
Okay, perfect, that's what it says in your chart. And do you happen to know if you're fully up to date on your vaccines?
Yeah.
Okay, perfect, that's good to know, All right, so you know your name. Do you know where you are right now?
I am at the hospital.
Great, and do you know why you're here?
Just a checkup.
Awesome, okay, so do you know who the president is by any chance?
Yeah, Joe Biden.
Awesome. So you're what we say is learning oriented times 4, which is great. And you seem to be dressed appropriately for the weather. And your general mood, you are answering my questions easily without any difficulty, no slurred speech, which is great. So now I'm going to start on my physical assessment. Okay, so I'm going to be going from head to toe.
Okay.
All right, so it shouldn't take too long. Okay, so now I have my gloves on as needed. So right now I'm going to be looking at the scalp. Can you come a little bit closer for me? Okay, awesome. Just looking at the hair distribution on the head. Doesn't look like there's any type of infestations, any type of skin breakdown. Face is normal cephalic. Face looks symmetrical. All right, is there any pain when I touch?
No.
Awesome, okay. Now I'm going to be looking at your eyes. I'm going to be using this as a pen light. So even on your eyebrows, evenly distributed, no signs of any type of skin breakdown. Looking at your eyes, your sclera is white. There's no sign of jaundice. And I'm gonna look at your eyelids, okay? They're pink. This one's pink, and so is this one's pink. Any pain when I touch?
No.
So no sign of conjunctivitis, no pink eye. All right, I'm gonna flash my pen light into your eye, okay?
Okay.
So I'm gonna cover up this eye. Cover you up. Great, so your pupils are from 5 millimeters. Then whenever I point the light, they constrict a little bit, which is normal. So now it's 3 millimeters, completely great, that's normal, okay? All right, is anything a little bit blurry whenever you see?
No.
No, any types of visual problems?
Mm-mm.
Like when you're in class, do you ever have to squint when you're reading?
No, I can see fine.
Okay, perfect, okay. And now I'm going to be checking out your ears. And since he's 17 years old, whenever I look at his ears or assess his ears, I'm going to pull up and back, and I'm looking at it with the light. All right, tympanic membrane is pearly white, and no signs of infestation, skin breakdown. And on your other side too, up and back. Same thing here, no signs of infestation, skin breakdown, tympanic membrane is pearly white. All right, no pain on your ears?
No.
You can hear everything I'm saying just fine, no hearing problems, anything you've noticed?
No.
Okay, great. All right, now I'm gonna be looking at your nose. Do you have any breathing problems?
No.
Do you know if you breathe through your mouth more or your nose more?
Probably my nose more.
Okay, that's great. All right, now I'm gonna be looking at your nose. Can you breathe through this nostril when I plug it? And then your other one? Okay, I'm going to be looking in your nose. Can you tilt your head back? Tilt your head back without any difficulty. Symmetric, no signs of deviation. There's hair, very minimal mucus. Mucus is normal color. All right, great. You can go back down. Now I'm looking at your lips now, okay? So looking at the rest of your face, no sign of any type of skin breakdown. Your lips are pink, no signs of dry, cracked lips. Can you open your mouth and say, "Ah" for me? So looking at his oral mucosa, your oral mucosa is pink. Your hard palate is also pink. No signs of any skin breakdown, swollen gums. Your tonsils are +1, which is normal, which means that we barely see them on a grading scale of less than 25%. And can you move your tongue up and back? Awesome. No signs of any gingivitis. All right, perfect. Okay, good. All right, now that is done, I'm now just going to keep moving down. I'm going to be looking at your neck. I'm going to be touching, okay? I'm just checking, okay? Any pain right here?
No.
This is for your lymph nodes, okay? So no pain in your lymph nodes. Nothing feels like it is swollen. Okay. All right. Now I'm going to lean you back a little bit. Okay, so in like a 45-degree angle with a pen light. Going to be assessing for any signs of jugular venous distension. No sign of JVD on the left side. And then no sign of JVD on the right side. Perfect. And now, can you scoot this way for me, please? No, this way. Okay. I'm going to be palpating your thyroid gland, which is right here on your neck, okay? So no sign of being able to palpate the thyroid gland, no signs of masses or goiter. Can you swallow for me? Perfect. Any difficulty swallowing?
No.
Okay, that's great. That's great. So no swallowing impairment, which is awesome. Okay, I'm gonna be checking on your upper arms. Okay, so looking at the skin, your arms look symmetrical. No signs of any skin breakdown, infestations. Your skin temperature from everything is appropriate for ethnicity. All right, I'm gonna be checking your cap refill. I'm gonna check your fingers. I'm gonna press down really quick. Okay, cap refill is less than 2 seconds, which is great. It means you're getting good oxygen to your body, okay? All right, now I'm going to be checking your pulses. So this is for your radial pulses. I'm gonna palpate bilaterally, and they are +2, rhythmic, and palpable. Great, okay. Can you squeeze my hands for me with as much strength as possible? All right, you have strong strength in your upper extremities. Can you shrug your shoulders? Good. Okay, you can shrug your shoulders. Can you turn your head to the left? And then also to the right. Okay, you did that a little opposite, wrong way, but you know, you're left from right. I'm gonna ask you to close your eyes and try and smell this and tell me what you smell.
Coffee.
Awesome, so cranial nerve 1 is intact. Okay, so now I'm going to be checking for your chest and upper and your torso area. Okay, so I'm gonna be checking your heart. Okay, I'm gonna put on my little stethoscope. This is already warmed and it's clean. I'm gonna be listening to your heart, which is in the left midclavicular 5th intercostal space, and I'm going to listen for a full minute. All right, your heart rate is rhythmic. S1 and S2 are present. I've listened for a full minute. Heart rate is 80, which is normal, okay? And vital signs have already been taken since before I got into your room, okay? So heart rate is okay. Looking at you, just breathing from right now, there's equal chest rise and expansion. No signs of difficulty breathing. No signs of nasal flaring or any type of retraction, substernal or intercostal. So, but this, the gown would be exposing you, obviously. Now that I'm going to be listening to your lung sounds, so just listening to your breathing, okay?
Yeah.
Okay, just take a deep breath whenever I press this, okay? Take a deep breath. Good. All right, down. Keep breathing. Okay, good. Well, you're doing great. Keep going. 4 more. Okay, I know you can get out of breath, but you're doing great. Okay, great. Lungs are clear and equal bilateral, no signs of any wheezing or rhonchi or any type of crackle, so there's no fluids, okay? All right, now I'm going to be checking your back. Can you sit facing this way, please? So looking at the back, and especially whenever you can lean over, this is great. There's no signs of any scoliosis, lordosis, or any kyphosis. And now there's no signs of any type of skin breakdown on the trunk or in the back. So there's no skin breakdown, no signs of infestation. Skin is of appropriate ethnicity. I'm going to be listening to your lung sounds from here too, okay, on your back, okay? Take a deep breath. Good, good. Clear and equal bilateral in the upper lobes. All right, all the 8 spaces. Okay. Take a deep breath, one more. Good, clear and equal bilateral in the lower lobes as well. Do you have any, I'm just gonna palpate. Any pain right here?
No.
In the flank pain? Especially when I palpate? When I percuss? Oh, you're ticklish? Okay, great. No pain, no flank pain, which is great. Just gonna be checking out those kidneys right there. And I can face right here. I'm going to be now assessing your your tummy area, okay? So I have a few questions about that. Have you been having any diarrhea lately? Like any liquid poop?
No.
Okay. When was the last time that you went poop?
Maybe this morning.
Okay. And the characteristics, were they kind of normal for you?
Yeah, it was normal.
Normal brown?
Yeah.
Okay, brown. Okay, awesome. And then do you have any difficulty, like have you ever been constipated?
What's that?
Constipated is when you are having a difficulty trying to go poop, which means that you're not going poop almost every day, or you're feeling difficulty to where you're kind of straining and you're trying to push too hard. That's when you're kind of constipated. Have you had that before or any time lately?
No.
Okay, awesome. Now I have a few questions about whenever you go pee. Have you noticed that you go pee at all a little too much or too often?
No.
Okay. Have you noticed any burning in your while you're trying to pee or difficulty peeing?
No.
Have you noticed any blood in your pee?
No.
Okay, great. So no signs of urinary tract infection or any difficulty peeing. Normal bowel pattern. Okay. I'm going to be looking at your belly now, okay?
Okay.
So now whenever I start my assessment with the abdomen, I'm going to begin with my inspection. Okay, so this is when I would be utilizing my pen light. And I'm going to be assessing it from 4 different angles, looking for any type of distension, or also any types of masses or shadowing. Skin is appropriate for ethnicity. Doesn't look like there's any masses. Okay, now I'm going to check your abdomen. I'm going to take a quick listen. Okay, I'm going to begin in the right lower quadrant. It's warm right here. Okay, so it's not going to be too cold. Just going to be listening. Vowel sounds are present in the right lower quadrant. Vowel sounds are present in the right upper quadrant. Vowel sounds are present in the left upper quadrant. And vowel sounds are present in the left lower quadrant. So that vowel sounds are not hyperactive or hypoactive, they're normal. Let's see. Now that I've also tated, I'm going to touch your tummy. You let me know if there's any type of pain or discomfort, okay? Any pain right here?
No.
No? Right here?
No.
Right here?
No.
Okay. Now right here?
No.
Okay, now I'm going to percuss. Any pain?
No.
Any ticklish? Okay. Any pain?
No.
Any pain?
No.
Any pain?
No.
Awesome. Okay, so there's no pain. Vowel sounds are present in all 4 quadrants based on percussion. There's no pain. Tympanic sounds are heard in all the quadrants. Okay, now I'm going to be looking at your lower at your legs. I'm going to be checking them. Okay.
Okay.
All right. So looking at your legs, they look to be symmetrical. Even hair distribution, no signs of redness or infection, no infestations. Skin is appropriate for ethnicity. I'm going to be checking your cap refill down here too. Okay, so cap refill is less than 2 seconds. I'm checking the dorsalis pedis pulse. This is right here on your feet. Okay, so just the pulses that are farthest away from your body. Pulses are rhythmic, palpable, +2. Awesome. Okay, are you able to, you're going to try and move your feet towards the ceiling. Can you move your feet up? Good, now move them down. And move them down all the way like a ballerina. Awesome. Now can you move them up against me with all your force? Good, strong. And down? Strong. Okay, strength is normal. Okay, do you happen to have any pain in the back of your legs?
No.
Awesome. Okay, so that looks great for that as well. Okay, can you stand up for me, please? Can you do, can you follow my rhythm like this? Can you do your foot to your leg like this and go down? And to your other side too? Good, okay. So lower cerebellar is intact. Can you sit down for me, please? Okay, so that seems great. Now I just have a few other questions for you, okay? Do you happen to, do you smoke at all?
No.
Okay, have you ever had any alcohol?
No.
Okay, that's great. And I have a few more questions. Have you ever suffered with any type of depression or thoughts about suicide?
No.
Okay, well that's great. And do you happen to have any questions for me?
No. No questions.
Okay, that's great. Well, it seems like I am all done. I have completed my assessment. I'll just relay any of my findings to my instructor and also your provider. So I'll be checking up on you soon, and I'm going to be leaving. I'm going to wash my hands, make sure I've offered the patient any time to try and use the restroom right now, any ability to assist with ambulation. Your call light is also within reach, so if you need me, you can let me know. Press the call light, and I can come to your room, okay?
Okay.
And I'm going to wash my hands for 20 seconds, and I'm going to leave the patient